Unfortunately, Nigeria is among 55 countries in WHO health worker on the WHO health worker support and safeguard list, with shortage of health workers. This calls for support for health workforce development and health system strengthening. I want to use the opportunity to call on states in Nigeria to remove embargo on employment of health workers, including young doctors for primary healthcare centers and community health workers, and also to invest in generally increasing human resource for health in their states. Otherwise, there is a barrier to our vision of achieving universal health coverage and improving the quality of care. I also call on all stakeholders to ensure that more frontline workers are recruited so that we can ensure substantial reduction in shortage of health workers at this level. Personnel budget and health facilities also need to be maintained and also in better shape for frontline health workers. To continuously generate and maintain comprehensive data on Nigerian health workforce, the Ministry of Health has established a National Health Workforce Registry, which is a web-based information system that links health workers to their respective health facilities. The registry will seamlessly help to disaggregate healthcare worker information according to cadre, gender, location, age, specialty, etc. I'm pleased to inform that the Ministry of Health has already established the registries in 25 states of the Federation, including the FCT, with support from partners, and the data is being uploaded as we speak. Information from the registry, such as in some states, has been used to produce a state health workforce profile and also a bulletin for that state. The Federal Ministry of Health has an evidence-based and gender-responsive human resource policy and strategic plan to guide investment in health workforce. We are responding to issues of health worker migration by putting in place policy measures that ensure more health workers are trained, recruited, retained, and better remunerated. The ministry is also taking steps to elevate the human resource health branch to a program to be dealt with by emerging human resource for health issues in Nigeria. The Human Resource for Health Conference is planned to discuss many of these issues as soon as possible and to find ways to mitigate the challenges that are ensuing from lack of insufficient training and numbers of healthcare workers. This year's week I'm talking about the Human Resource for Health Week. It's significant because, again, it marks the 75th anniversary as countries all over the world come together to promote health, keep the world safe, and serve the vulnerable under the auspices of the World Health Organization, so that everybody everywhere can attain the highest level of health and well-being. I want to congratulate the World Health Organization on this 75th anniversary of active service to humanity, and to thank them especially for supporting the health sector in the entire world and in Nigeria, technically and financially, in so many years, as we are finding the best ways to provide healthcare service to our citizens. We support all efforts to strengthen and support the World Health Organization in their task of attending to global health issues. I wish now to join the WHO DG, Dr. Tedros Ghebreyesus, to call on OECD to to respect all the provisions of the World Health Workforce and support and safeguard the list. And at the same time, I call on global leaders, donors, and multilateral leaders to allocate long-term sustainable funding and to implement policies that protect and support health workers everywhere. I want to thank all other partners who have not yet mentioned today, but who have been integral to keeping Nigeria's health system going and strengthening it. And I want to hear mention UNICEF, mention STDO, mention USAID, and GIZ, and COICA, and Japan, JICA, and all others who stand by us and continue to stand by us. And I thank you all for sitting here and or standing here and listening to this my statement.